Hey, this is the Queen, host of the Home Health Queen High Tea Show, broadcasting live each week on Saturday at 11 a.m. Central Time from the Fishbowl Radio Network studios in Bedford, Texas. Log on to hear all things home care and home health. Listen in to get all the tea because I'm going to bring it to you, whether it's home health, hospice, assisted living, and much more. So be sure to log on each week on Saturdays at 11 a.m. Central Time. Catch the Queen on the Home Health Queen High Tea Show. Peace. Good morning, everybody.
Good morning.
Welcome to the Home Health Queen High Tea Podcast Show. Jingle bells, jingle all the way. Hey, y'all know how we do it. Y'all, thank you for joining us this morning. I am known as the Home Health Queen, and this is my trusty sidekick, Mr. Derek J. And you know what my mama called that boy. What do you say? Hey, Money Green. Y'all, that's how we coming in this morning. But first, before I start, y'all know I have to give thanks to God because without him, I would not be here. None of this would be possible. Yes. So with that being said, we're going to jump right into it. Y'all know we have 50 minutes to shake, rattle, and roll. And so with that being said, let's go.
Shake, rattle, and roll.
Shake, rattle, and roll.
You just made that up.
You know how I do it. I just come off the dome. Y'all know. Like, wait a minute. TikTok already started. Y'all stop giving me y'all money. It's the holidays. I see y'all giving me y'all money. Thank you for the donations. Not required. All right. So,
Queen, how was your week?
Woo, Lord. My week was tiring. It was trying. But by the grace of God, I made it through. I had to catch a flight to Indy this week. Okay. And so I left out of town on Sunday, and I had the opportunity to work in a client's office that had been scammed. Yeah, I said it.
Oh, Lord.
Yeah, but I had to go seriously and work in their office for a few days to help them get on track and lay some foundations because the state is coming back January the 23rd. And so I had to go ahead and get in and help them. And so it was wonderful. I tell you, it's always, guys, whenever y'all hire me to come to your offices and you deal with priority consulting, when I get there, everybody is so quiet. Everybody is nervous. And I tell them all the time, don't be nervous. I'm just a person. But you know what they told me? By the time I left, them ladies said, we ain't never worked this hard in our life. Now, get this. They done been licensed for 2 or 3 years. So I had to go, and that's what I've been doing. So okay, so that's what I was doing. Well, how about you, Mr. Derek J? What was going on with you while I was gone?
I too traveled this week.
Yes.
Monday I flew out to Nashville. Had some things to do in Nashville, and flew back home Wednesday. And check this out.
What happened?
Flew back home, unloaded my stuff at home, and then went Christmas shopping because Christmas is this upcoming week.
Did you buy me some?
Wait.
Did you buy me some?
Hold on, child.
Okay.
All right. I run into Dick's Sporting Goods.
Okay.
I'm in there 10, 15 minutes. Come back out. Whole back window busted out my truck. Broken my truck.
They got you.
They got me.
They got you.
They got me.
Let me ask you a question, though. Did you leave something on your seat, on the floor, a car charger? Because I be trying to teach y'all.
I had my backpack
Look
and
at that.
duffel in the back seat. But yeah, they got me. So
teachable moment.
It was.
Teachable moment.
So, I ain't ghetto. So, I went straight to the glass store,
got
that fixed immediately. I'm not about to have no paper bags in my truck.
You know what? So. I can't do it with you. I cannot. Y'all, let me just go ahead and clean that up. Some people can't afford to go get they smashed window.
I'm sorry. For those of you that have bags and tape on your windows, God bless you.
Okay. And we're going to just move on with that. But you know what? I tell people all the time I have been too violated that way, and it makes you just want to throw the whole car away.
I know.
I don't want no car somebody done been in. But I tell everybody this, y'all, it's the holiday season.
It is.
Especially to my young ladies, be very aware of your surroundings. Y'all holding all these Gucci's and Fendi's and Louis and fake Hermes. We always got to throw a little shade. Y'all, they don't know it's fake. Y'all hold it
If that
tight.
H look like a B, I think we know it's fake.
But they don't want that. They want the contents inside. So, guys, be mindful. We are wrapping up. We are in the holiday season. And with that being said, I'm ready to get down to business because we only have 50 wonderful minutes with you guys.
Well,
and I have a lot.
Already.
We have a call already?
Already.
Well, I guess we're going to go on and answer this call.
Let me let you guys know the phone number to call in today because we do want to hear from you. The caller already knew the number. The number has not changed. It's 556-6239. So call in with your questions today. We want to hear from someone new today.
All right.
All right, who do we have on the call today with the Queen?
Hi, good morning. It's like calling from Houston.
Good morning, H-Town.
Good morning, H-Town. That's Lectoria. Good morning, Lectoria. How are you, my love, and what's going on?
I'm doing pretty good. I just have a question.
What's your question?
Okay, so I'm in the group home or boarding home section. Now, after you get licensed by the state for the group home, are you allowed to take private pay clients?
Absolutely, you are. Anytime you are already licensed with the state, because you're in Texas, y'all, this is one of my clients. That's a good question because we almost to the finish line and she getting excited. But absolutely, you will be able to take any private pay clients inside of your facility if you choose to take private pay, if you choose to take Medicaid, or we get you credentialed for other insurances where you can take these types of payments, Lectoria, you're not going to turn down nobody. So to answer your question, absolutely. Private pay is always good. That means that green comes right to you in your hands. So I hope that answered your question. I thank you for calling in because, look, you jumped right on the line before we even dove in. So I appreciate you. And look, Lectoria, Merry Christmas, baby.
Merry Christmas. Thank you so much.
Yes.
I appreciate it.
I appreciate you as well. All right, y'all. Well, thank you, y'all. She jumped right in. She said, "Queen, I'm gonna get my call in today. Y'all ain't finna bombard these phone lines." And before we jump right into it again, guys, let me thank all my listeners from around the world. Guys, I want to thank Germany. I want to thank United Kingdom. Guys, China. We had Mexico. Y'all, the numbers are coming in, and I really thank you guys. We joke around a lot here at Priority Consulting. But at the same time, y'all know when I give, I'm going to give 200% within this industry. So I want to go and review last week's topics, Derek, where we came in this thing and we talked about credentialing. With different, wasn't it good? I got so many good comments about that segment last week. And so I just want to give a quick recap. Whether you're in home care, which is non-medical, home health, which is medical, whether you are an assisted living, a boarding home, guys, in order to be a full service agency and or facility, and let me just go ahead and give a little terminology, ancillary facility. That's what we are looked at in this home care and home health industry. Guys, you got to diversify by being credentialed with different payer sources so you can diversify and get money coming from Blue Cross Blue Shield, money coming from Medicaid, money coming from private pay, money coming from Medicare. So see, I can help you with that. And so last week we wrapped with questions and answers. And y'all, I'm going to just go on and tell y'all, I was so excited to talk to y'all. Y'all know I threw out a price that really wasn't. So I'm going to tell you, baby, look, I got y'all emails, and I'm going to honor my word to the credentialing book for dummies because I want y'all to know how to credential the proper way. Everybody think credentialing is just clicking and uploading some documents. Guys, I believe in direct credentialing, and that's directly with these insurance groups. It's much more to it. So that's what we did last week. That's what we hit on. If you missed it, please go to Fishbowl Radio Network on Facebook and go scroll down till you see my beautiful face, and this handsome man, because I told y'all I'm real confident and cocky in all that I do. So let me just tell you, go look at that episode so you can too learn. And then we're going to jump into today's subject. Derek, I've been thinking, because I think when I drive, I think when I ride, I think when I'm on the planes, trains, y'all, I think when I'm asleep. Today's topic is going to be franchise versus direct ownership within this industry.
All right.
All right. Guys, in our industry, there is a lot of different ways to be a part of it. And what I am noticing, as I too have clients who have been kind of stuck and or jumped into a franchise because this seemed as the easiest way to go because things were promised to them, I want to talk to you guys about the differences, okay? And I want you guys to hear me clearly when I speak. A franchise within the home care and or home health industry is just that. That means you have a contract with a franchising entity and they basically own you. I'm going to just say what it is. So they basically tell you where you can position your office, what counties you can serve, but then they allow you to use their brand, right? They allow you to use their brand in order to attract more patients because that's what patients have been hearing. Now, I can't, because look, ain't nobody coming after Queen, but I can't tell you the names of some of them. But I will tell you all of them have something in common. And this is only my personal opinion, my personal views, but I'm going to always tell y'all the truth. A franchise is a scam. You know, I will say what I mean. And when I say this, let me tell y'all, they pull you in this industry stating that they will provide you with the territories and the patients will come. They tell you that they will give you leads. Derek, it is a difference between a lead and a actual referral.
Okay.
Come on, listen now. Come on, preach, Queen, because see, a lead is nothing just that. See, I could lead you and say, Derek, I would like to take you to brunch today, but soon as we leave, I get on my phone and act like I'm talking to somebody, and I say, y'all, I told Derek I wanted to take him to brunch, but really I'm not taking him to brunch. I just wanted to do it for the show. That's what franchises do. They get you to contract with them directly, and they say, we're going to give you a website. So what? They say, we're going to let you put our names on your brochures that are already formatted. So what? Then they say, here we go. We're going to give you leads, and we already advertise. We have big, beautiful commercials, and people are going to come. Well, the truth in this industry, y'all, and I've experienced it. I'm not just talking. If I talk something, it's through experience. The leads, I'm going to just go ahead and tell y'all, most of the franchises, and I hate to hurt y'all feelings, so listen to me close if you have a franchise. Those leads that they calling y'all with every day, every week, y'all is people sitting up like in a call center.
Wow.
And so they calling you to say, hey, this is me with priority. And, you know, we have some leads for you. So here's 10 names because our contract states we going to give you some leads. And then you get excited as the agency owner because you thinking you have a referral. A referral is not a lead. A referral is something that is guaranteed based off of the patient's answer when you call to make sure and verify that this referral came from a referral source and that the care is actually needed. Because if that care is actually needed and I call and I say, hey, Mr. Johnson, how are you? My name is Queen with priority. The doctor and or the referral or the state gave me your referral and stated that they've approved you for 20 hours a week. And I was calling because I wanted to get you on my schedule to do your assessment. And if you're skilled, the doctor would have sent that. And then I would have said, I'm calling because the doctor sent me your referral and your order for us to do the admission into the home care agency sector. So I was calling to make sure that that's okay with you and get you on my schedule. Oh, but then a lead says, hey, Mr. Derek, how are you? My name is Queen with Priority Consulting. I'm calling you because I'm with ABCDEFG franchise or whatever your name of your company is. This is how the other end gonna go. Oh, baby, thank you for calling me. However, I just signed up with another company. See, that's a hustle. Because I can guarantee you if you have a franchise, call me right now. Call us at, what's our phone number? Because I want them to call in today.
214-556-6239.
I'm talking to my people.
214-556-6239.
I need y'all
and the
to
people
understand.
saying amen and all of that.
Yeah,
on
yeah.
your TikTok.
Okay, well, TikTok, call in if you are under a franchise and or if you've talked to a franchise, call in. Let's talk about it. Because, guys, I want y'all to understand direct ownership in this company. In a franchise, what a franchise does in our industry is in your agreement, because it's a contract that you actually get, because you're contracting to use their name, their brand. They tell you, okay, you can go to this territory only. Why would I do that when I can own my own agency, get licensed through my state on my own? And then the franchise says, just for carrying my name, you're going to pay me a flat fee of, say, $5,000 a month. And then based on The referrals that you actually admit and you build, I want a percentage of your profits. So at the end of the day, these people that's looped up in franchises, y'all are paying anywhere from $5,000 a month all the way up to $12,000 and $15,000. Y'all, I got a client. Y'all know when I get to bouncing, I get excited. I got a client right now today that I'm trying to help her maneuver her way out of a franchise. Y'all, this is not, I told y'all I ain't new to this. I'm true to it. This is what I do for a living at Priority Consulting. If y'all are stuck in these franchises and y'all see y'all money ain't moving and patience ain't growing, y'all need to call us because I'm getting tired of that too. So I'm here to tell the truth. I told y'all when I got on social media, when I decided to do this podcast, I was going to do nothing but tell the truth about the industry. Because see, Derek J., I got enough years behind me where I can back it up. I got enough years behind me that I've done research. And the research says, y'all, slow down. Don't be so excited to jump into the industry because everything that sounds good may not be good. You see what I'm saying? And if the franchise has been good to you, then baby, hats off to you. Because you one of the ones that's beating through it, through the game. But it ain't nowhere in the world, God's green earth, I'm going to give a franchise money for doing nothing. It's no way. All right? So let me tell you, can you afford to pay out $15,000 to $30,000 a month? A month on your agency. Hey, if you can afford that, stick with that franchise. I'm going to just tell you the truth with it. Or would you prefer to keep that profit margin as an agency owner and pay myself a correct salary and operate my company from the profit margin the right way? Y'all gotta learn. Do your research. Everything that look good ain't good. Oh, well, Queen, the franchise have commercials. Well, God dog it, I just did a commercial. You can do a commercial on your own. And y'all, another thing, everybody running into these websites. Well, Coach such and such said they give me a website and a beautiful brochure. Y'all, I'm gonna put y'all up on some game. Don't nobody care about no website in this home health industry. The only people, and I'm going to tell y'all, it's a proven fact, maybe 15% of your census may come from referral sources that do a Google smoogler and find you on your website. That's for people that is independently looking for somewhere or some agency to take care of their loved ones. Most referrals come from word of mouth. Word of mouth. Okay? So y'all, when people put this number, hey, I'm gonna charge you $25,000, and what I'm gonna get for $25,000? Oh, I'm gonna get a license with the state. Oh, I'm gonna get y'all a beautiful, pretty website. Oh, I'm gonna get some brochures. What about invest that $15,000, $25,000, $30,000 in some real education? What about investing that $15,000, $20,000, $30,000 and into yourself through education to learn the industry? You know what I'm saying?
Yeah.
Does that make sense?
That's good.
Am I spitting the knowledge for y'all?
That's good.
Are y'all listening? So, y'all, with that being said, I think we're going to take a little break. I need to take a
quick break.
I need to take a little break. And y'all, because look, I want everybody to go put your little jingle bell hat on. I wanted to wear me one today and I forgot. So, y'all, catch me back. Don't go nowhere. Get us some water and come on back.
We want to hear from you. So come back, call in at 214-556-6239. And don't forget to follow the Queen on all social media platforms, Facebook, Instagram, and TikTok. All right, so we'll be back. Peace.
Do you own a home care or home health agency? Have you ever wondered how to start a home care or home health agency? This is a healthcare symposium you don't want to miss. Our keynote speaker is the very own home health queen, Katina, CEO and founder of Priority Consulting, with special guest speakers from the Center of Medicare and Medicaid Services, Anthem, and much, much more. March 14th through 16th at the Downtown Aloft Hotel in Dallas. Get your tickets now at EncoreEvents.live. EncoreEvents.live. Call 713-401-9771. That's 713-401-9771. Or for more information, go to www.thehomehealthqueenconferences.com. That's thehomehealthqueenconferences.com. This is the healthcare symposium you don't want to miss with our very own home health queen, Katina, CEO and founder of Priority Consulting, March 14th through 16th at the Downtown Aloft Hotel in Dallas. And don't forget to check out the Home Health Queen podcast show. every Saturday, 11 a.m. Central at FBRN.US.
All right, all right.
Welcome back. Welcome back. Y'all know I'm old
We're
school.
in the mood of singing.
Baby, we're in the mood of singing. Baby, it's the holidays. And y'all, I can't even much
Wait,
sing.
what's your favorite Christmas song?
Silent night.
Oh, the Temptations version?
Holy night. What's yours?
Man, you know, there's a lot of great ones out there. There's nothing like Christmas without Mariah Carey. I'm sorry.
You know what? I likes Mariah, but you know what,
she just
Mariah
opens up the season.
Yeah.
I don't want to hear her live, but I'm good for what's recorded.
Baby, the recorded is good, ain't it?
The recorded Mariah is good.
The recorded is good. All right.
But you
then.
got Boys to Men.
Right.
Right. You got Temptations, like you mentioned.
I'm old school.
There's a lot of good songs
I'm
out
old
there.
school.
What's that? Hang low the mistletoe.
Ooh,
Yes.
I gotta get to know
Yes.
you better. Them boys say
This
what
Christmas.
and then you do like this to the person you really like. But look, y'all, if y'all don't like them, y'all better throw that mistletoe down. Don't do
Right.
it. Don't do it. Or move over to the side. Money Green, we're gonna get back into
All
this
right,
thing
all right.
because I am really going in on franchise versus direct ownership. And guys, feel free. Y'all know I always stay on social media, even when I'm on this podcast. So, guys, you can type your questions on Tickety Talk because y'all know y'all where I started. So I'm always rock with y'all. But type your questions so I can try to answer them. Guys, call in. This is your time to speak with me and get your questions answered. But I got to get back to doing what we do. We're talking franchise versus direct ownership. Another thing about, and y'all, these are only my personal opinions, and these are my views from all of my experience, okay? So I always like to say that because I know some people, you might be thriving in a franchise. Congratulations. You making so much money you can afford to get them people that money. So at one point in my life, I even thought about franchising something that I owned out because, and doing it the right way. Because let me tell you, another person told me that they joined a franchise. I want to hear your franchise stories. So call in because I really want to hear it. But another person told me.
214-556-6239.
I know somebody, even if you're in another country, please call in because I want to talk franchise. I really want to talk to somebody that's under one. And if you are successful in it, call me so you can say, well, Queen, let me tell you about my franchise. Because I'm telling you guys, if I could show you a way to direct ownership and not give all the money to the franchise, but invest it back in yourself, that's going to help you. And guys, going to a franchise is not an easier or a faster way to get in the industry. It's not. It's not. We all take the same steps. They're going to get you a license with your state wherever you are. Once that license is approved, then they're going to start the credentialing and contracting with all the state entities that's needed. And then they'll do the credentialing process. Again, you're still going to be responsible for marketing. You're going to be responsible for knowing about the industry. You're going to be responsible for laying the foundation within this industry in order to get your referrals up. You know what I'm saying?
Okay. I got a question for you.
What you got?
Does franchise help when you get surveyed in the industry? Or?
That's a good question.
Yeah.
Ooh, that's a good one. Derek J just asked me, if you are signed up or under a franchise, do they help you get through survey? I have a client right now out of Atlanta. Are you on my live? Show your face if you are. Guys, a franchise is just that, a franchise. They are not going to help you get through your survey. They are not coming out to do mock surveys to help you get to lay that foundation. Once you sign that agreement and they take your money, you might as well say you on your own. And this is not something I'm just pulling out my head. This is something I know for sure. Do you see what I'm saying? But if you owned your company directly and you went through somebody called Queen, you found a little company called Priority Consulting, where Queen is a beast in this industry. I'm worldwide and certified. I am certified through ACHC and CHAP. Guys, let me tell you something about this industry. Once you get a license, y'all, it tickles me pink when I am sitting in my bed scrolling social media And these coaches, trainers, and gurus, they be posting everybody license. I got another student license. Y'all, that ain't nothing to brag about. That don't impress me. But see, it impresses everybody in that social media world because they thinking, oh, they got a license. Y'all, that license ain't nothing but a piece of paper. But again, if you on my social media, on my Tickety Talk, you know what impresses me, knowing what to do with it, having the foundation laid. I just left an office this week in Indianapolis, and they've been operating, and another coach set them up. I came in there with a full vengeance, and they looked at me, and they said, Queen, I'm going to tell the truth. I didn't know that all this was required to run this company. I said, absolutely it is. It is required so you can be protected from recoupments. Everything we do inside and lay the foundations, I do it for a reason. At the end of the day, we all want to keep the money that we're out here spending and receiving the right way. Because if you don't have your foundation laid, it all goes back to knowing what to do in an agency on a weekly basis, a quarterly basis, an annual basis, and a monthly basis. If y'all don't know that, then you're setting yourself up for failure. So these franchises is not going to hold your hand to prep you for survey. See, I always got to pat myself on the back. If you are a client of Priority Consultings, I just don't take your money and let you go. You can ask any of my clients right now, Lectoria, who's on Tickety Talk, China Michelle, Siobhan. See, I can just go off the dome. All over the world, I have clients all over the map. Now, they will say, Queen ain't returned my call. Well, that's because Queen got about 1 million of y'all that she trying to process and take care of. But one thing about it, you can always reach my staff Monday through Thursday, 9 a.m. to 4 p.m. and Fridays, 9 to 12. Even when you get the license, you still gonna need me, and I must always be there to answer. What about a franchise, Queen? Well, good luck with that. But I bet you every month when that invoice is due, they automatically taking money out your account, and they've done nothing per se but get you a license, give you a name. And Larry, I'm gonna tell you the truth.
And some leads.
And some leads. There you go. You look, give me a high five on that. Bam. And some leads. Y'all, I don't care about a lead. I don't care about no website. Boy, they tickle me, dear, because when they finally come to Queen, they finding me on social media. I say, well, what did the other person do for you? They got me a license. I got a website. I got a little banner. I say, how much you paid? They say, $15,000. I say, 15 G's. I say, for a website, a license, and a banner. I say, come on now, quit, y'all, stop. It's time to stop. So with that being said, my question for you is, do you want to be educated and elevated in the industry? Do you want to learn from a certified healthcare consultant? Do you want to surround yourself with people in the industry that you can feed off of, share ideas on, bounce back on one another, and go to the next level together? A franchise, in my opinion, is not the way to do it. Now, if you just got money you want to give, Queen will take it. It's the holidays. Queen will take it. And let me just let you know, guys, in order to start a franchise, these jokers out here, they charging anywhere from 25 G's to 100 G's just to come in under them. But what if somebody named Queen said, I don't care what state you in. I don't care what state you in. You ain't got to pay to come in under nothing. What you going to do is you going to get the foundation laid. I'm going to show you how to do it. I can hold your hand through it. We can even do it for you. Or I'm going to go on and throw this out there. I never talk my prices. For $500, I'll show you how to do it on your own and do your own application. It's called the application walkthrough. These jokers on social media, now look, boy, I got some fans. Baby, I got some peeping Toms. You know, that's what I tell them. Baby, they be peeping. I tell them, don't peep, show your face. Because I, too, at some point wished I had someone to mentor me. Don't look at me as a threat. Look at me as a wealth of knowledge. Because I can help you. Y'all, I tell people all the time, it's easy to run game if you are not educated in what you're trying to learn. Did y'all just hear what I said? I tell y'all all the time, read. It's so easy. Go to your state's website. Look up whatever license category that you're trying to get into and read. It tells you all the license qualifications, rules, and regulations. It's not that difficult. It's not. So, Derek, right there, what I want to do is I'm stop preaching for a second, and I wanna look at what the Tickety Talk people saying. Do anybody have any questions? I see y'all talking on here, baby. Somebody said a subscription benefit. Mahogany, how you doing? Mahogany, call in. I don't know what that was. Nurse Lily, I see you. Y'all call in because I can't really just read the screen, but I see. But guys, another thing that I do want to touch on today, when it comes down to running your own agency, we joke a lot, but I want to tell you there's no better reward than knowing that you have the foundation laid in that agency and you're able to receive referrals from good referral sources and care for patients. If you get into this industry and or if you are already in this industry and you are stuck, it's because you have not had proper training. On social media, guys, I look at the comments. I see your messages. Everybody says, Queen, how can I? What should I do? The first thing is you have to, in order to move forward and you're stuck, especially if y'all have a license and you don't know what to do, that means you paid. How many of you guys have paid for a license and you just been sitting on it because you stuck? If you paid for a license and you don't know what to do next or you don't know the expectations of the next steps, call in to me at 214-556.
6239.
Call in to me because, y'all, I want to hear y'all voices and I want everybody around the world that's listening to be able to hear your voices as well, because the question that you may be holding, I'm sure someone else have that same question and I can answer it for them. And so, y'all, this is the sharing season. So we're going to share. We're going to share this knowledge. We're going to share it. Thank you. Thank you for that. So again, if you guys have been going back and forth between owning an agency or getting into a franchise, benefits, I told you the non-benefits of a franchise. Now I want to tell you the benefits of an agency. Owning direct ownership of running an agency. You don't have to pay any fees to anybody based on your profit margin. That's benefit number one. And to me, that's the highest and best benefit of it all.
Yeah.
Right?
That $15,000-$20,000 is yours.
It's mine. It's mine. Benefit number two. When a referral source calls your office and you have to say that's not in my region or that's not in my, they call it territories, you just lost a patient. See, with being a direct owner, any patient that calls your phone or any referral that come in, as long as you notified the state when you first applied for that license that the counties that you're going to be able to service, as long as that's one of your service areas, you can take any patient no matter where it comes in from. See, a smart business person once upon a time named Queen. See, in my agencies and I set up my clients, if you're going to be an agency, be one. Don't just limit yourself. And some states will limit you because you're new to only 3 to 5 counties. But most states will let you just list all counties. Why not list all counties so if a patient come in over there, you ready to take them? And then it goes back to staffing. Well, Queen, I'm scared because I don't have the staff. Y'all, it's always ways to get staff. I keep telling you that is the hard.
I'm sorry, I didn't mean to cut you off. I got
you
excited.
scared me. He got excited. He heard that doom, doom, doom. We know what that means. Guys, it's a call coming in, but let me finish this sentence before you go to it, Derek J. Let me tell you guys something. Direct ownership means you can have 100% control of that agency. Direct ownership means you don't have to pay nobody a percentage of your profits. Direct ownership means you don't have to go in giving them money off top and getting nothing but a website. Come on, let's go with that phone call.
Yo, who's on the call with the Queen today?
Hi, yes, I'm calling from Kentucky, and I'm trying to figure out what happens if you pay someone to guide you and get licensed, and then you get stuck, and they don't follow up with you.
Okay, all right. So so first off, the company and or person that you paid and you get stuck, you gotta make sure that follow-up is part of your original agreement. I will tell you that if you paid someone for a startup is not follow-up. A startup is not consultation for hours. So you really have to know what you're getting into, because if you paid someone for a startup and or an application, it ends there. Follow up is going to be another agreement. So you got to make sure it will be another agreement in order for consultation services. But if your agreement stated
Yeah.
that the follow up was consultation services, then if you cannot get it from them, then you need to do some research and look for another company to help you achieve your goals.
Okay, but what if, you know, they were holding documents that were supposed to be delivered to you?
Okay, so what you need to do is try to get those documents that were supposed to be delivered. If you've exhausted all your avenues, then you got to go get you some legal help. You got to get your legal help, because if you paid somebody for something, then they need to deliver on it. Period. You got me?
Okay, so what about verbal agreements versus written agreements that, you discussed, but not in the contract?
Okay, verbal is nothing. Verbal is nothing. Without written, you can't do anything. Verbal is not good as the conversation we having right now. If it's not in there verbally, then verbal, that's just somebody talking to you. So the best thing, the advice I'm gonna give you is try to reach back out to them. Get you a contract, get it in black and white. Once you get it in black and white, then we can move forward outside of that. So with that being said, that is it. It is time to go to commercial. And thank you so much for calling in.
Do you own a home care or home health agency? Have you ever wondered how to start a home care or home health agency? This is a healthcare symposium you don't want to miss. Our keynote speaker is the very own home health queen, Katina, CEO and founder of Priority Consulting, with special guest speakers from the Center of Medicare and Medicaid Services, Anthem, and much, much more. March 14th through 16th at the Downtown Aloft Hotel in Dallas. Get your tickets now at EncoreEvents.live. EncoreEvents.live. Call 713-401-9771. That's 713-401-9771. Or for more information, go to www.thehomehealthqueenconferences.com. That's thehomehealthqueenconferences.com. This is the healthcare symposium you don't want to miss with our very own home health queen, Katina, CEO and founder of Priority Consulting, March 14th through 16th at the Downtown Aloft Hotel in Dallas. And don't forget to check out the Home Health Queen podcast show every Saturday, 11 a.m. Central at fbrn.us.
All right. Guys, that was a good phone call.
It was.
That
it
was
was.
it. And what I want to do, because we had to go to break, but what I want to say is this, guys, this is the thing. Do not do anything verbally. Get everything in writing. Do not pay 100% for services that you do not have a contract with. I will tell you this right now, because Derek, I love clients. And I will tell you, I tell people all the time, at Priority, we're not perfect. But I say this all the time. If I help you, if it's something that's not on your agreement, it's out the kindness of my heart, right? So y'all be sure everything that you want to pay for, you get it in writing. Get service agreements, get contracts. Because I'm going to tell you, look, I tell the truth on myself. I help clients so much outside of their agreements, and then when I can't do it, they get upset. Well, guess what? We wasn't contractually obligated to do that. I was doing it to help you. Period. You see what I'm saying? So make sure everything that you want is in that agreement, because if there are they're not consultants, coaches, trainers, or whoever out here that you have paid to do a service and you don't have them under agreement at any time, they have the right to stop. If it was a verbal, they have the right to stop. You got me?
I do.
All right. Thank you for that caller. Thank you.
That was good.
That was good. All right then. And guys, so back to what we were stating. Benefits of direct ownership. I am a firm believer that if you own your own company and you don't have to go back to franchises, because what happens with a franchise, you don't get any education once that license once you have that license. Okay. Once you have that license, I don't care what state you are in, you need to sign up with your state's notifications of your state's licensing entity. Every state sends out email blasts whenever there's a change, because this is how you will be notified of all changes that may come through. If you don't keep yourself in the know in this industry, this is where you get broken down, you get lost. Once you get broke down and lost and you don't have that foundation laid, things are going to just scatter and fall apart. Period. And so I tell my clients, and I'm telling anybody that's listening in today, I want y'all to do two things. If you're thinking about getting in this industry, the first thing is to do your research. Do your research through your state's entity's website. Secondly, once you do your research and you read the rules and regulations and qualifications for whatever entity you want to get into, once you do that, then you can seek professional guidance, whether it's from Priority Consulting and or some other firm. Because you need to know some terminology. I'm not stating they need to know everything, but you need to know something to know that people are truly, truly qualified. Do you see what I'm saying?
Yeah.
And so that's what I need people to know and understand. But Derek J, I got a question for you.
Okay.
You ready for Christmas?
Nope.
All right, that's wait a minute. He said nope.
When I leave here, I have to finish up my shopping.
We gotta go do a little Christmas
And
shopping.
I'm putting the stuff up under the bed in my truck so you don't see it.
Oh, look, and now he just told y'all where he's
I'm
going.
gonna
So
oh,
look,
Lord,
you see what he just did.
They
see what he just
still.
did?
But Queen, what I'm learning from this show is you have to invest in yourself, right?
Right.
People like going the easy route. Choosing a franchise, that's the easy route, right? But you're wasting money. You're not really profiting at all from it. But if you take the time to invest in yourself, like you said, learning, studying, doing research, and then invest in your own company, that's the way to be successful.
That
So,
is.
yeah.
And that goes with investing in education.
Education, all of that.
That goes with investing when these people like Queen have a conference. You know, we had a conference.
Yes, March 14th.
March 14th through the 16th, Guys Center for Medicare and Medicaid Services will be on my stage. Anthem, the director of Anthem, will be there. And guys, I'm the keynote. But did I just hear a phone call?
We did. Who's on the call with the Queen today?
Yes, this is Kiana from South Carolina.
Good morning, Miss
Good
Kiana.
morning.
How are you?
I'm very well. How are you? Thank you.
I'm well, thank you. What questions do you have for the Queen today?
Yes, ma'am. I was wondering if you might be able to touch just briefly on some of the administrative duties that you would be responsible for and in direct ownership, because I believe that a lot of people are under the impression, I know I once was, that when you go with a franchise that they do all of these things for you, but I found through other people that they basically give you a whole lot of paperwork, a whole lot of templates. They dump it on you, and then they leave you to do everything for yourself. And you would already have to do that with direct ownership. So I don't understand what people really see that's so attractive about the franchising, but I think that they need to realize that whether you're direct ownership or whether you are with the franchise, you still have the same duties. It's just with the franchise, you don't make nearly as much money because they take so much of it from you.
Perfect question, Kiana. Thank you so much for bringing that out so people can hear you with that. So basically, with what, like Kiana stated, even with the franchise versus direct ownership, we all have to follow what's called, Kiana, our state's rules and regulations. So that means all that administrative side, you are still responsible for. That franchise cannot do QAPI for you, Kiana, can they? That franchise can't do EPP, emergency preparedness, can they? Nope. You're going to do it inside. See, that franchise is not going to tell you to when and how to hold governing body board members meetings when you have a change within the organization. See, that franchise just gonna give you some templates, like Kiana said, and throw it out. But at the end of the day, you still gonna have to run that agency based off of the rules and regulations and guidelines of the state. It has nothing to do with a franchise. So why not go direct ownership? But people are thinking that the franchise, because of the way that they sell these programs, is they're going to do all of this for you and take all the heavy lifting away. That they cannot, because in every state, Kiana, you have to have an administrator, an alternate administrator, a manager, alternate manager, and so forth. Those are your duties inside of that office every day to make sure that the documentation and the processes are being laid. The franchise in a whole nother state, they can't do nothing for you. And then they throw you all this paperwork and say, there you go, figure it out. Well, underneath direct ownership, you're going to have the same paperwork. You're going to figure it out and you're going to learn it and do it yourself. So again, you've benefited nothing from that franchise, just a bunch of money that's wasted. And you got to learn this industry anyway, right, Kiana? So now why not own it and learn it directly for yourself? Does that make sense?
Absolutely. Thank you so much.
Thank you, Kiana,
Thank
for
you.
calling in South Carolina. You ready for Christmas?
Yes, ma'am.
All right, then. Well, Merry Christmas to you. Merry Christmas to you. And thank you for calling in. Now, with that being said, guys, we are wrapping up. We almost, boy, let me tell you something. That 50 minutes go fast, don't it?
It goes fast.
That 50 minutes goes fast. But, guys, I do have a couple of questions that was emailed over to us, Derek. And there's a couple of questions, and I want to get to them because someone told me, they emailed in and they asked us a question. And I told them that I would address it this Saturday. Okay. So there was a young lady out of Missouri, and she asked me, she said, Queen, credentialing with multiple insurers, are there any conflicts or overlaps between certain insurance providers I should be aware of? So to answer that, it's no conflicts and or overlapping when it comes down to the credentialing process, because you will be direct credentialing with each separate insurance group. So it's no overlapping. Now, say, I don't know, in your state in Missouri, say like Anthem, good example. Anthem owns United Healthcare, Humana, and Blue Cross Blue Shield. Because Anthem is the sole owner in the corporation that they work under, that bracket, you still are going to have to go to Blue Cross Blue Shield directly. You're still going to have to go to United Healthcare directly, and you're still going to have to go to Humana directly. So there's no overlapping. Just because you have a contract for one does not mean you have them for all, although they're all underneath Anthem. So I hope that answered your question. And question number 2. Practice and billing concerns. Are there any codes or claims issues that commonly arise during the credentialing process? Okay, so this is a very good question, so I'm going to break this down. Credentialing has nothing to do with billing and or codes. It does not. Credentialing is to get you into that network so that payer source can pay you. Now, once you become fully credentialed with any MCO, there is a paragraph in that contract that is called billing privileges. Most MCOs will give you their codes to bill, the rates to bill, whether they want you to bill hourly, per visit, and or units to bill. Guys, units is every 15 minutes. So they give you their whole billing section to teach you and tell you what the expectations are now that you are a contracted agency with the insurance group. So I hope that answered your questions, okay? I hope that answered your questions. So now I have another question that's come up, guys, and somebody asked me, Queen, can you tell me the difference between your conference and other conferences that are being held during the same time? Okay, all right. Let me go. I got to sell myself. That's a very good question. Guys, in the month of March, I will be holding what's called the One Woman Show Healthcare Symposium. There are other coaches, trainers, and gurus, if you're on social media, y'all hear me poke fun at them all the time, that are holding conferences. I'm not scared of no competition the same month I am. But let me tell you the difference between what I have noticed and what I'm doing. See, that's a good question. The difference is this. See, at my conference, I'm all about the industry. I'm all about home care, home health, assisted living, boarding homes, behavioral health. I'm all about educating and elevating. I am putting people on my stage that matter, the people that pay us in the industry. Center for Medicare and Medicaid Services. Right there is enough to drop the mic and shut the show down. Them other people, I can't say no names, but one of them, she got a heavy hitter. I call her a heavy hitter. She's a reality star. And y'all, let me tell you, if I could ever sit across the room from this young lady, I would be, let's talk business. But one thing I know about this reality star, I love her to death. She's not in the home care or home health industry. So if you want to go and be with a beautiful reality star and take some pictures, baby, that's the conference I need you to go to, because see over there, it's all about who we can show. Let's go show the people I was with this person. That's the kind of stuff they doing over there. Then it's another one. Y'all, she out of Atlanta. Boy, I heard she gives some good old parties. Y'all can even pay to eat with her and her husband. See, I hear that. This is what I only stuff I done heard from my people, because my people comes back and tell me. See, my people say they've been to these conferences, and when they leave, they don't know nothing more. This is the difference between my conference. I guarantee you, when you leave the Queen's Conference, you're going to know way more about the industry when you leave than when you sat in that chair. See, Derek, when I get up on that stage, I'm all about educating. I'm about elevating. I'm about making sure people succeed. People been telling me lately, Queen, you a motivator. I say, what? Now I got motivational speaker behind my name. But I want to tell you guys, if you really want to know the truth about this industry, I joke around a lot. All I have to say is Center for Medicare and Medicaid Services will be on my stage. Y'all, these are the people that pays us on a federal level and a state level. They pay hospitals. They pay SNFs, skilled nursing facilities. They pay home care. They pay home health. Guys, this is where you're getting your money from, unless it's coming from a private pay sector. And with that being said,
We got to go.
we got to go again. Y'all, we got to go because we got a lot of things to do. Y'all, this is our last show before Christmas. What I want to do is wish everybody a very Merry Christmas. And what my shirt say? A merry everything. And y'all, let me just say this. I appreciate you from listening all over the world. I appreciate the phone calls. I appreciate the comments. Y'all stop getting mad at me because I'm not responding to y'all DMs. I keep telling y'all, email me at thehomehealthqueen@gmail.com and go check out the conference at thehomehealthqueenconferences.com. And Money Green, you know how we do it. Y'all ain't got to go, but y'all got to go somewhere. Thank you. We'll see you same time, same place next week. Peace.
Hey, this is the Queen, host of the Home Health Queen High Tea Show, broadcasting live each week on Saturday at 11 a.m. Central Time from the Fishbowl Radio Network studios in Bedford, Texas. Log on to hear all things home care and home health. Listen in to get all the tea, because I'm going to bring it to you, whether it's home health, hospice, assisted living, and much more. So be sure to